Did you know that nearly 55 million people around the world are living with dementia? And every 3 seconds, a new case is diagnosed. Even more alarming is the fact that dementia has become the 7th leading cause of death globally. But what most people don't realize is that in many cases, the decline in brain function isn't simply due to age or genetics alone. Shocking new studies are revealing that some of the most commonly prescribed medications, the very ones sitting in your medicine cabinet, could be quietly sabotaging your brain. And this is especially true if you're over 60. These drugs could be shrinking your brain, accelerating memory loss, and even contributing to the onset of Alzheimer's disease. The most frightening part: you may be taking these medications every day without even realizing the potential damage they're causing. In this video, we're going to expose 9 popular medications that have been scientifically linked to rapid dementia symptoms. You'll want to stay with us until the end, because the #1 drug is the most dangerous of all. It's widely prescribed, and very few people know just how much damage it causes. But don't worry, we won't leave you hanging. We'll also reveal 3 scientifically proven foods that can actually prevent dementia and protect your brain health naturally. Let's dive in. The first medication on our list is antihistamines, specifically first-generation antihistamines. Many seniors rely on over-the-counter antihistamines, like diphenhydramine, often found in Benadryl, to help with allergies, colds, or trouble sleeping. On the surface, these drugs might seem harmless, but they belong to a class of medications called anticholinergics. These drugs block a neurotransmitter in your brain called acetylcholine, which plays a crucial role in helping your brain cells communicate, especially when it comes to memory and learning. Without enough acetylcholine, brain fog sets in, memory slips become more frequent, and over time, brain shrinkage can occur. One study published in JAMA Internal Medicine found that seniors who took strong anticholinergics daily for just 3 years had a 54% increased risk of developing dementia. The scariest part is how subtly it starts. You might notice that you're forgetting appointments or misplacing your keys more often, but over time, that mild forgetfulness can snowball into full-blown cognitive decline. And since many of these antihistamines are sold without a prescription, people assume they're safe. For aging brains, however, the cost can be devastating. Next, we have benzodiazepines. If you've ever struggled with anxiety, insomnia, or muscle spasms, there's a good chance your doctor has prescribed a benzodiazepine. Medications like Valium, Ativan, Xanax, and others belong to this class. While these medications can offer quick relief and help people relax, their long-term effects on the brain are far from gentle. Benzodiazepines work by increasing the activity of a neurotransmitter called GABA, which slows down brain activity to create a calming effect. However, the brain doesn't like being slowed down indefinitely. Long-term use of these drugs has been linked to memory problems, confusion, and even structural changes in the brain. A study in the BMJ showed that people who took benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's disease. What's more troubling is that many seniors are prescribed these medications for sleep, and then continue using them for years without realizing the neurological toll they're taking. If you're feeling more tired during the day, having slower reaction times, or finding it harder to follow conversations, these are not just signs of aging. They're warning signs that your brain might be in trouble. Our next medication is proton pump inhibitors, PPIs. Millions of older adults take medications like omeprazole, pantoprazole, and esomeprazole to reduce stomach acid and relieve heartburn or acid reflux. While these drugs are effective in treating gastrointestinal issues, they may be doing something far worse behind the scenes. PPIs have been linked in several studies to cognitive decline and an increased risk of dementia. The theory is that by blocking stomach acid, PPIs reduce the body's ability to absorb essential nutrients like vitamin B12 and magnesium, both of which are crucial for brain function. Low B12 levels, in particular, can lead to confusion, memory loss, and even neurological damage. One German study involving more than 73,000 seniors found that those who regularly used PPIs had a 44% increased risk of dementia. Seniors often use these medications for years without ever re-evaluating their need for them, not realizing they may be starving their brains of vital nutrients. If you've noticed that your thinking has become slower, or if you feel more confused after meals, the culprit might not be the food you ate. It could be the pill you took before eating. Now let's talk about antipsychotics. These powerful drugs, such as risperidone, olanzapine, and quetiapine, are often prescribed to older adults to manage behavioral symptoms in conditions like dementia, schizophrenia, or bipolar disorder. But ironically, even though they're sometimes prescribed to calm agitation in people with memory loss, they may actually be making the problem worse. Antipsychotics work by altering levels of dopamine and serotonin in the brain, two chemicals that are key to motivation, pleasure, and cognition. While this can stabilize extreme behaviors, it also dulls brain activity overall, leading to sedation, emotional flatness, and more dangerously, a higher risk of accelerated cognitive decline. The FDA has even issued a black box warning for these medications, especially when used in elderly patients with dementia, citing an increased risk of death. Long-term use has been linked to significant reductions in brain function, and patients may become more withdrawn, have trouble following conversations, or lose the ability to perform simple tasks. What starts as mild confusion can escalate into full dependency and the loss of independence. A tragic irony in medicine, using a drug to calm the brain, only to find that it may be erasing it. Sleep aids are another medication category of concern. Z drugs like zolpidem, Ambien, and esopicolone, Lunesta, are commonly used to help seniors with sleep problems. While these medications may help you fall asleep, they do so by slowing down brain activity and interfering with your brain's natural sleep rhythms. When you sleep, your brain goes through different stages, including deep sleep and REM sleep, which are essential for memory consolidation and mental restoration. Drugs disrupt this cycle, leading to a lower quality of sleep, even if you're unconscious for 8 hours. Worse, they've been associated with sleepwalking, confusion, and next-day brain fog. A study in the British Medical Journal found that seniors taking Z drugs had a significantly higher risk of developing dementia and falling due to impaired alertness. You might feel groggy in the morning or more forgetful about basic things like names or directions. That's not just poor sleep. That's your brain struggling to keep up after being sedated night after night. Next up, we have tricyclic antidepressants, which are often prescribed to treat depression in older adults, especially in response to increased isolation, health issues, or the loss of loved ones. However, some of the older classes of antidepressants, particularly tricyclics like amitriptyline and doxepin, come with a dark side. These medications have strong anticholinergic effects, meaning they block acetylcholine, the same brain chemical involved in memory and thinking. For the elderly, the aging brain is already more sensitive to changes in neurotransmitter levels, and what starts as a mild antidepressant can slowly impair cognition, cause drowsiness, and worsen focus over time. This can mimic or even accelerate dementia. A 2015 study published in JAMA showed a dose-dependent relationship between anticholinergic drugs like tricyclics and dementia. The more you take and the longer you take them, the higher your risk. Bladder control medications are also a concern. Medications like oxybutynin and tolterodine are commonly prescribed to help manage overactive bladder, a problem many seniors face. But what's not widely known is that these drugs are also powerful anticholinergics, blocking acetylcholine in the brain and having a direct effect on cognitive performance. In fact, a study conducted at the University of California, San Francisco, found that seniors who took these medications had significantly smaller brain volumes and performed worse on memory tests. Researchers noted actual brain shrinkage in areas responsible for memory and cognition. Many seniors are put on these medications for months or even years without reassessing their mental effects, which can cause confusion, difficulty planning daily tasks, and trouble thinking clearly. Statins are next on our list. Statins, such as atorvastatin and simvastatin, are commonly prescribed to lower cholesterol and reduce the risk of heart disease in seniors. However, while they protect your heart, they may be putting your brain at risk. The brain contains about 25% of the body's total cholesterol, which is essential for building and maintaining neurons. Statins lower cholesterol not only in the blood, but also in the brain, which can interfere with the production of important neurotransmitters like serotonin and dopamine. A study published in Pharmacotherapy found that 75% of patients who experienced memory problems saw improvement after stopping statins. If you're experiencing new memory issues while taking statins, it may be worth discussing alternatives with your doctor. Finally, we reach the most dangerous category: anticholinergic combination medications. These medications combine multiple anticholinergic effects into one pill or regimen, and they're found in many cold and flu medications, gastrointestinal drugs, and even muscle relaxers. The cumulative impact of these drugs can deplete acetylcholine to such low levels that memory, learning, and even basic functions begin to break down. A study following 3,434 older adults found that those with high cumulative use of anticholinergic medications had a 54% increased risk of dementia, even if they stopped the drugs years before symptoms appeared. Now, after discussing the hidden dangers of these medications, let's turn to something more hopeful. 3 foods that can help protect your brain from dementia. These foods are backed by science and can make a significant difference in supporting your brain health. Blueberries are a great place to start. Known as brainberries, these small fruits are packed with antioxidants that help fight oxidative stress in the brain They've been shown to improve memory and delay brain aging. Fatty fish, especially salmon, sardines and mackerel, are rich in omega-3 fatty acids that are essential for maintaining healthy brain cells. And lastly, leafy greens like kale and spinach are full of nutrients that help protect brain cells and enhance memory. By being aware of the medications that could be harming your brain and incorporating these brain-boosting foods into your diet, you can take steps to protect your cognitive health. Talk to your doctor about alternatives and support your brain with the right foods to help prevent dementia before it's too late. Remember, dementia doesn't happen overnight, but preventing it can start today.